Understanding tests and their results in healthcare. During this short film, we are going to present some information about tests that are commonly used in healthcare and describe what you need to know about these tests and their results. We hope it will help you to think about the questions you might want to ask your doctor and what the results could mean for you, your family, and friends. At the end of this film, you should have learnt that there are many types of tests that are used to indicate changes to your health. Doctors use these tests as part of routine care. The results of tests can vary. The results of these tests should be considered alongside other types of information. It's okay to ask questions about your test and the results to help you discuss what will happen next with your doctor. There are many tests used in healthcare to diagnose a condition or monitor your health, and they usually involve taking samples of blood, urine, saliva, or tissue from your body. Doctors prefer to use blood tests to give them the information they need. However, sometimes they need more information, and this might mean having other tests, for example, a biopsy. Having a liver biopsy is a short procedure in which a small amount of liver tissue is used for examination. We are going to talk about blood tests because these are the ones most widely used by doctors. Blood samples are sent to a laboratory for testing, and they look at the levels of certain molecules, called biomarkers. For this reason, you may hear these tests referred to as biomarker tests. These tests can be used to assess your general health, check if you have an infection, check how well organs, such as your liver or kidneys, are working. Common tests that you might have heard of before are full blood count. This blood test can be used to assess your general health and check for a range of disorders, including infections. Cholesterol tests. Cholesterol tests help predict a person's risk of developing heart disease and to make treatment decisions based on this risk. Blood sugar test. A blood glucose test measures the amount of sugar called glucose in a sample of blood. Your doctor might order this test if you have signs of diabetes. Liver function tests. Liver function tests are used to check your liver is working properly. For example, to look at whether your liver is inflamed, damaged, or affected by any of the medicines you take. The beginning of a journey. When the doctor takes the blood test, it usually marks the beginning of a journey. Once the doctor has the results of your test, they will talk to you about the next steps, which could include further testing or treatment. You and your doctor should discuss what the test results mean and any possible courses of action. The difference between a diagnostic test and a monitoring test. When doctors use tests, they are looking to see if there have been any changes in the types and ranges of certain molecules. A diagnostic test is used to confirm the presence of disease, usually following the report of symptoms or based on the results of other tests. A doctor might need to do several different tests to discover if you have a disease. On their own, most blood tests do not give a diagnosis, but provide an indicator of change, which can be confirmed by further tests. Some examples of tests that are often used to monitor a patient's health include cholesterol tests or liver function tests. A monitoring test is repeated on a regular basis, for example annually, to try to detect changes to your disease. Changes in test results can occur before any symptoms are felt or seen, and help the doctor to consider treatment options at an earlier stage. It is important for you to know what type of test the doctor is using, what the purpose of that test is, and whether it's being used for monitoring or diagnosis. If you are offered a test to monitor your health, you may want to talk to your doctor about what could happen if your test results indicate there are some changes. Fluctuation of scores. You should be aware that the scores of any test can vary quite a lot without there being any major changes in your health. For this reason, your doctor might suggest that you are retested at a later date to see if your scores have settled back to normal, and they might ask you to make changes to your lifestyle. Let's look at a story to illustrate this. Patient and carer story. Excerpt from notes from Mr. and Mrs. B. A patient, Mrs. B, and her carer, Mr. B, described an example of having had some blood tests to monitor health. After a routine blood test, Mrs. B's liver function tests were significantly above normal and were at the top of the scale. If the doctors had used the initial liver function scores as part of their diagnosis, then this could have possibly been interpreted as the patient requiring a liver transplant. However, the patient was not thought to be in immediate danger, and the doctors, the patient, and carer had noticed that the scores on this test fluctuated over time. Following the introduction of new medicines and a change of lifestyle, subsequent tests showed significant reductions, and eventually the marker returned to the normal value. When there is no immediate danger, doctors might suggest a watch and wait approach, and may also propose changes to medicines and lifestyle. In this case, there was a realization that scores can change over time. If any changes are proposed, or a period of watch and wait is suggested, you can ask questions to find out why this has been decided upon. Factors that affect test results. When you are asked to take a blood test, you may be given instructions about what to do before your clinic appointment, such as fasting, not eating for a period of time, avoiding alcohol, or not smoking. For example, you might be asked not to eat or drink anything other than water for 8 to 10 hours before a fasting blood glucose test, as they want to test for glucose, sugar, in the blood. The test results can be affected if you choose not to follow the doctor's instructions. For certain tests, your doctor may ask you not to smoke or drink alcohol prior to the test. So, if you are given any instructions before the test, it is important to follow these. You can always ask your doctor or nurse about this if you need to. When the doctor sends off for your blood test, some of the questions you might want to ask are: what is the purpose of the test? What kind of test is it? Is it to help with diagnosis or monitoring? How often will I have this test? Are there any specific instructions that I should follow? When should I expect the results? What do test results mean? Your doctor will talk about the results and your options with you. For example, a positive test can mean having more tests, either to confirm the findings of the first test or to get a clearer picture of what is happening in your body. These might be a repeat of the first test or arranging additional tests to confirm the results of the blood test. Or you might be given the option of waiting and having the test again in a few weeks or months' time. Test results can be false. All tests can vary over time, and sometimes they can show changes when there aren't really any, or they might not show the changes that they should. This is something we all need to be aware of. No test is 100% accurate, and all tests will occasionally provide a false result. However, doctors usually take account of a range of different information and do not make a decision based on one test alone. As you saw with Mr. and Mrs. B's story, sometimes a test can suggest something is wrong when it's not. This is called a false positive test result, and it can happen when molecules measured in the blood are high for a reason that is not linked to your health. For example, The result can be affected by what you have been eating or drinking before the test. A positive test result can be worrying, and your doctor might advise you to have some further tests to check the result. Doctors will also look at other information about your health and decide whether further tests are needed. The opposite can also happen. Sometimes there is something wrong, or something that needs more investigation, but the test result suggests everything is fine. This is called a false negative test result. A negative test result can sometimes give a person false reassurance because they think that nothing is wrong when there is. If your test results come back all clear, but you still feel unwell, you should talk to your doctor. Discussing your results. When your doctor has the results, they will discuss this with you. It's okay to ask questions such as, what does this test result mean for me? Do I need further tests? What other information is used alongside the test to inform you about my health? What are my treatment options now? What impact will this have on my life? You should also be able to ask to see a copy of your results, although we recognize it's not common practice for patients to see all their results. We have developed a list of questions for you to use in a consultation to make sure you have all the information that you need. This information can be found on the LIVErNORTH website at http://www.livernorth.org.uk.